1 out of every 5,000 people have Marfan syndrome. The gene coding for Marfan syndrome is on chromosome 15. We chose the mutation G1013R, the most common mutation known for Marfan syndrome. Marfan syndrome is dominant and affects the fibrillin-1 gene, which codes for fibrillin-1 protein that makes up the connective tissues in our eyes, heart, bones, and muscles. Because of the multiple mutations known to cause Marfan syndrome, it is less accurate to diagnose using genetic testing and more accurate for a doctor to diagnose a patient with Marfan syndrome using this criteria chart. Many patients require surgeries for the symptoms of Marfan syndrome that they express. To understand the difficulties of the life of someone with Marfan syndrome, we conducted a 3-week experiment in which we expressed pre- or post-surgical care of the top 4 most common symptoms of Marfan syndrome. Each research member randomly selected one of the 4 symptoms to express that symptom pre- or post-surgical attribute for 4 days of the week. These 4 symptoms were elongated limbs, scoliosis, aortic aneurysm, and ectopia lentis.
Marfan syndrome has not only physical difficulties, but sociological difficulties as well. Our social anxiety for each situation was measured daily for 3 weeks. Pain and annoyance was also measured daily for the 3 weeks. Elongated limbs is caused by the overproduction of transforming growth factor beta. It is the most common physical attribute of Marfan syndrome. In our experiment, we replicated living the life of a patient who has fragile wrists by wearing wrist supports. Expressing the symptoms of arachnodactyly and fragile wrists had almost no effect on the social aspect of our lives. We were still able to do such things as talk to people of authority like our boss, walk down the hall to class, and eat with friends in the cafeteria. On the other hand, wearing a wrist brace caused slight pain and annoyance. Putting on the wrist brace every morning was a pain because it usually had to be done with assistance and was often wrapped too tightly. Simple tasks such as typing on our computer, taking notes in class, and buttoning our coat were made more difficult. While washing our hands was also annoying because the bandage would get wet and soggy. Scoliosis is caused when the ligaments of the spine become so loose that they cannot firmly hold the bones of the spine in place. Those with a spine curve around 20 to 40 degrees use a back brace to treat scoliosis. In our experiment, we replicated living the life of a patient who has scoliosis by wearing a back brace. Expressing the symptoms of scoliosis had almost no effect on the social aspect of our lives because it is common to see people with back problems, and the brace was typically covered up with clothing. The brace was worn for most of the day, even during sleep, as Marfan syndrome patients wore it 23 hours of the day. Expressing the symptoms of scoliosis caused little pain or annoyance, but we did tend to overheat and the back brace got itchy.
An aortic aneurysm is caused when the aorta swells to about 2 times greater than normal. When the aorta reaches around 5 to 6 centimeters in diameter, emergency open heart surgery is necessary immediately or the aorta will burst. In our experiment, a chest brace was worn on our upper chest area to create the pressure and sensitivity of post-heart surgery. Expressing these symptoms had almost no effect on the social aspect of our lives because the chest brace was easily concealed with clothing. On the other hand, wearing a chest brace caused slight pain and annoyance. Light exercise such as doing push-ups caused slight pressure and was difficult to do with a chest brace on. Picking out clothing that would conceal the chest brace posed to be slightly annoying and burdensome.
Ectopia lentis is a displacement of the lens and requires immediate surgery. In our experiment, we replicated living the life of a patient who just had lens dislocation surgery by wearing an eye patch held with bandages. Expressing the symptom had unexpected, significant effects on our social life. We didn't want to go to class and we became significantly depressed. It was embarrassing to talk to strangers and we frequently skipped meals because of the embarrassment we felt going to the cafeteria. Wearing an eye patch also had unexpected physical effects. Within the first hour of wearing an eye patch, headaches ensued, and we often experienced blurry vision and periods where our eyesight would go black. We also lost most of our depth perception. Most importantly, it was difficult to pay attention to what was going around us, especially during class. For our experiment, we initially predicted that there would be no difference between the social anxiety and the pain we felt for each symptom we expressed. And a ANOVA test showed us that there was a significant difference between the social anxiety we felt versus the pain we felt while we expressed each symptom. This chart shows that expressing the symptoms caused significantly more social anxiety than pain.
don't you worry, child. See, heaven's got a plan for you.